This presentation will focus on the Marburg virus, which is a bit like Ebola's batty cousin, or at least that's the name that I gave it here. Now, why do I call it Ebola's batty cousin, you might ask? And hopefully you'll have the answer to that question by the end of this video. To start, let's have a look at the virobiology and the taxonomy of the Marburg virus. It's a member of the filovirus family, which gets its name from the filamentous, almost string-like structure of the virus. And so you can see in this electron microscope picture, it has these long strands, and each one of those is a virus particle. Now, the only other member of the Filaviridae family is some strains of the Ebola virus, which is why it gets that nomer as a relative of the Ebola virus. Marburg is wrapped in a glycoprotein envelope as one of its survival mechanisms, and it is a single-stranded RNA virus. Some background on the history of Marburg. So the first Marburg outbreak that was recorded was in 1967. There were some African green monkeys that had been imported from Uganda that were being studied in some European laboratories. And some simultaneous outbreaks occurred in 1967 in Marburg and Frankfurt, both in Germany, and in Belgrade, Yugoslavia, which is now Serbia. 31 people had contracted this illness and became ill, starting with those laboratory workers, and then it spread to several medical personnel and then some family members after that. And by the end of this first outbreak, 7 people had died in total. This virus is endemic to the South Central African region, so outbreaks have been recorded in Angola, Uganda, the Democratic Republic of the Congo, and in Kenya. And so this next slide will explain the viral territory in a little bit more detail. The reservoir for the Marburg virus is the Rosettes bat, which is also known as the African fruit bat, which was shown on the title slide here. So this is one of the Rosettes bats. The reason that Marburg virus disease is endemic to this South Central African region is because that is a central location within the territory of the Rosettes bat. So you can see these red countries shown in red, are those endemic regions to the Marburg virus. And then this purple territory, this purple dotted line, shows the Rosettes bat migration territory. So it goes in this South Central Africa region, actually extends all the way west to the Pacific Islands, South Asia, including India and Laos, even southern China, and a little bit north of Australia as well. These bats show no sign of the disease, but Marburg hemorrhagic fever can be a zoonotic infection, can be contracted from bats. It can be contracted from infected non-human primates, as evidenced by those African green monkeys in that first outbreak. And even pigs have been shown that they can shed the virus too. And so research is still determining what other mammals may be susceptible in an outbreak of Marburg and what could be an amplifying host and potentially not showing signs of the disease, but still shedding that virus and causing spread. It's a highly contagious virus, highly contagious from human to human. Can be spread through a variety of direct and indirect mechanisms, including through aerosols, droplet nuclei. It can be spread through direct contact with blood, secretions, or other body fluids from an infected person, or even direct contact from a deceased person who had the disease when they were living. It can be sexually transmitted. It can be transmitted through fomites. It can be a cross-placental infection spread from a pregnant person all the way to the fetus, and can also be spread through breast milk. Accidental needle sticks present a really large risk for healthcare workers that are working in these regions because an accidental needle stick from somebody who had Marburg is associated with a more severe disease presentation. Now, Marburg virus causes Marburg hemorrhagic fever, which is also known as Marburg virus disease, or MVD for short. After an incubation period of 2 to 21 days, the disease progression can be really quick and really deadly. So those initial symptoms in that prodromal phase can be fever, chills, headache, muscle pain. It can look like a couple of other diseases that are pretty common in this region. But then after 3 days, those symptoms begin to worsen and that patient declines significantly. So they have this severe watery diarrhea, that abdominal pain and cramping. And healthcare workers have reported that patients at this 3-day stage appear really drawn and almost like ghosts. They are so worn by this disease. They have these deep set eyes and just extremely lethargic because this disease has taken so much out of them. After 5 to 7 days, those hemorrhagic symptoms set in. So you'll notice some fresh blood in vomit and feces of a patient. They'll start bleeding from the gums, from the nose, even from the vagina. And you'll notice spontaneous bleeding at venipuncture sites as well, which makes it a real challenge to provide supportive care for these patients. Because if you're trying to administer medications, if you're trying to administer fluids, and trying to do a venipuncture for an IV, they'll spontaneously bleed from those sites. And so that's another source of bleeding that you need to control as a clinician. If the disease has spread to the central nervous system, it can produce irritability, confusion, and aggression, which altogether can make it even harder to treat these patients. And this disease is pretty deadly. The WHO estimates that it has up to an 88% fatality rate, and usually death occurs after 8 to 9 days of symptom onset. Although supportive care can often increase the odds of survival for a patient. Now, unfortunately, there is no specific medication, treatment, cure, or vaccine that can hold off the Marburg disease and its symptoms. But the best that clinicians can do is really provide that early and consistent supportive care. So replacing those fluids that are lost from that severe diarrhea and trying to prevent systemic shock due to the hemorrhaging. So trying to provide supplemental oxygen, maintaining that blood pressure, and replacing the lost blood that occurs from the hemorrhaging. And also, of course, treating any secondary infections that may occur along the way. But because Marburg is so highly contagious and it's so deadly, the most important factor to consider in a Marburg outbreak is prevention, trying to stop the spread before more patients become sick. So wearing proper PPEs or personal protective equipment is really crucial. So you can see in this photo 6 healthcare workers that are donning that full PPE to prevent any kind of contact with inhaled droplets or direct contact with the body fluids. But it's also really important to educate the community that's experiencing the outbreak on how to prevent the spread of the disease. That will help them, really take control of what's going on. And this is especially important if the community that's being hit has specific rituals or cultural traditions involving the deceased, especially if those traditions involve direct contact or touching the deceased person, because as we saw in a previous slide, direct contact with a deceased person who had the Marburg virus is one way of spreading this virus. So it's really important to find the line between encouraging these culturally sensitive traditions while also preventing the spread of Marburg. And now, as we hit the end of this presentation, you hopefully understand a little bit more about why the Marburg virus is called Ebola's baddie cousin, and a little bit more about the virus and the diseases that it causes. So in all seriousness, this is it's less well known than Ebola, which is that related virus, but Marburg's devastating effects are just as bad as its filovirus cousin and are typically felt hardest in poor and rural communities, especially those with low access to healthcare and resources. But hopefully, in the coming years, there will be breakthroughs regarding the treatment and vaccination for Marburg, for Ebola, and for many other deadly diseases like these. So I'd like to thank the World Health Organization, the CDC, and a few other sources for providing the information that was used in this presentation. And I hope you enjoyed learning a little bit more about the Marburg virus.